Good morning, everybody. Great to see you. I am Nigel Denby. I was with you last week with Dr. Naomi Potter, and we are going to be talking this week about irritable bowel syndrome, IBS. It's an area of nutrition that I've worked in for about the last 20 years or so. And one of the reasons I'm particularly interested in it is because it affects so many people, and also it's one of those areas where I think an awful lot of people have just been left out in the cold, really kind of being told to get on with it and live with it. And the reality is you really do not need to do that. IBS, irritable bowel syndrome, is something that we can do so much more about. The knowledge that we have in that's grown over the last 20 years or so is really phenomenal. And I would say now that we can help about 75% of sufferers to feel enormously better. So what I'm going to try to do in the next few minutes over this session is talk you through the ways that I tend to approach managing IBS with patients in clinic, and obviously nowadays through virtual clinics. So let's start by thinking about what irritable bowel syndrome is. So essentially, we're dealing with a mixture of symptoms that you might expect to see either together or individually over a period of about a month, and you would expect to see them repetitively. So this means that if you go out for a curry one night, or you eat something that just doesn't suit you and you have an upset tummy the next morning, that isn't irritable bowel syndrome. That's just having an upset tummy the next morning. What we're talking about is repeated episodes of bloating, of abdominal pain, of a change in your bowel habit, which might mean that you go from, you become quite constipated, or you experience diarrhea, urgency, and loose stools, or you may well find that you jump from one of these to the other and backwards and forwards like that. So we've got abdominal pain, we've got bloating, we've got a change in bowel habits. You might see mucus in your stools, and that would mean when you go to the loo, if you look in the water, there's like a cloudy white sort of liquid in there, or you might pass blood in your stools, which doesn't necessarily mean there's anything sinister going on, just that there is a problem. And then also you might experience urgency, or a feeling, we call it incomplete evacuation, which basically means you go to the loo, you have a poo, but you just don't really feel like you've ever finished. Now, any of those, either in combination or individually, repeatedly over the period of about a month, are a good indicator that you have irritable bowel syndrome. The other thing that you might find is that if you've already gone to your doctor and you've been referred to see a gastroenterologist, they might well do some investigations where they do an endoscopy, that's a camera down your throat, or a colonoscopy, where that's a camera up your bottom, to have a look what's going on. If they don't find any particular cause for the sorts of symptoms that you're experiencing, then you may well then be given the diagnosis of irritable bowel syndrome. And again, what that generally means is you have all these symptoms that go from here to here, and we don't really know what the cause is. So at that point, you're usually either told, get on with it, or you might be referred to see somebody like me. So what I'm looking for is really, well, what is the cause of this? There are dozens and dozens of products that you can buy over the counter in pharmacies that treat the symptoms of it, that might either help you go to the loo, or control your gas, or stop you from going to the loo. these are all things that can make IBS more manageable because they do, to some degree, control those symptoms, but they're not necessarily treating the cause. And that's what I want to try to find and to help you find. So I kind of have what I call my 4 pillars of investigation. So when we would first meet, I'd ask you to do a food and activity diary for me for at least 3 or 4 days, and also an IBS symptom diary over the same period. And then we'd actually spend a lot of our time talking about when this first started for you, when you can remember it. Sometimes it's a case that people can remember it either before or after they had children. Maybe if you're married, you sort of think about, well, was that going on when I got married, or is it then? If you were at uni, and often it's quite useful to think also, if you did go to uni, did you take a year off and go travelling? Because that will relate to some of the other questions that I might ask. Ah, there you are. I thought I'd lost you for a minute. Goodness. Okay, so now then, if we know when it started, we can then start thinking about what those potential causes might be. And the things that I'm always looking at are, first of all, is there something mechanical that's going on with the digestive system that is causing a problem? The next thing I want to think about is the environment of your gut, and particularly gut bacteria. So I'll talk to you about that. Then I want to think about, is there something going on with particular foods? And I'll talk to you about how we would approach that. And then lastly, is there something that is an emotional or psychological contact that might as well also trigger symptoms? And these often will might be that you've got issues with all of these things, but we might well find that 1 or 2 of them are really the predominant features of where your IBS has started from. I should say as well, if you've got questions along the way, just fire any questions. I'm obviously doing it on my own today, but I can see the questions coming up, and I'll really try to answer those as best I can as we go through this. So do send me questions, and of course you can direct message me as well later on if you've got specific questions. So let's go back to our pillars of investigation, and the first thing we might think about is the mechanics of the gastrointestinal tract. And really, when it comes to IBS, the most likely area that you might find there's a problem in is your colon or your large intestine. Just to show you, your colon rises on the right here. You have the transverse colon, which tends to be just under your rib cage, and the descending colon on the left. So it's like an N shape. Okay, and that's where most of it's the end part of digestion. It's where a lot of the waste starts to build up, ready for you to have a poo. And in that area, in the colon, you have a lot of circular muscles. So they work like a snake's body or a piping bag. And for some people, particularly if you notice that your symptoms can be, somebody's just asked, can this be related to hormone imbalances? Sarah, absolutely yes. It's one of the reasons I often will see somebody for menopause or PMT and IBS at the same time. So absolutely, yes, it can. Your abdomen is a lot more sensitive to pain and discomfort when your certain hormones are higher. So back to this colon. Yes, these circular muscles essentially squeeze the waste along that pipe, ready to go into the rectum and the anus, and you have a poo. It's often that sensation that you have when you know you need to go to the loo. It's called peristalsis, and it's these muscles squeezing the waste along. Now, not ever so scientific, but there is certainly a theory that for some people who particularly can be quite stressy, that it's perfectly reasonable that you may well channel your stress to your gut. In the same way that somebody else might grind their teeth at night and get headaches, it's perfectly feasible that you can channel that stress to your tummy, and that these muscles actually stop responding to the normal triggers to contract and relax, which is then pushing the waist along. Normally, that trigger would come when you think about eating. You might even find that if you just think about what you're going to have for lunch, or if you walk into a supermarket and smell fresh bread, that could be enough to trigger those muscles to move some of the waste along. And essentially what they're doing is picking up a signal from your brain that you're likely to eat and that they need to clear some space ready for the meal that's coming. If that isn't working so well, what you can find is that those muscles can tend to contract, and then everything's kind of backed up and stops for a while. At the same time as all that's going on, you'll build up gas. When you build up gas, your diaphragm pushes down to protect your internal organs, and that's what causes the bloat. That bloat can feel quite hard, despite hard, like a football, and obviously be quite uncomfortable. Your clothes start to feel tight, can cause pain in your abdomen. So these muscles have contracted, they've stopped everything moving, and then I think, yep, I'm back again. Okay, so you get that urgent feeling of, oh my God, I've got to go, and I've got to go now. So one of the really simple things that we can start to look at is just teaching you some very gentle abdominal massage at bedtime. This would be a nighttime thing to do for about 5-10 minutes before you go to bed. You're kind of changed, ready for bed, lie flat on the bed, maybe put some nice music on. This is a relaxing thing to do. There's no point thinking, oh my God, I've got to do my massage. No point adding stress to your bedtime routine. So you do it, it's a nurturing thing to do. You could even do it lying in the bath, is lovely. Somebody can do it for you. You could use a little bit of carrier massage oil, can work really well, but you don't want anything with perfumes or essential, you just want a plain carrier oil. So you're lying flat on your tummy and you basically are following the trail of your large intestine, gently massaging from right to left for about 5 or 10 minutes. Now what that should do is slowly allow those muscles to relax, and through the night you'd be dispersing the gas. Don't worry, you're not going to be lying there farting away all night. That gas will just disperse naturally, and in the morning you begin to wake, ready to pass a bowel movement and get on with your day. Now that's one thing. It can help. It's not the answer for everything, and none of the things I'm going to suggest are the answer on their own. You build up a toolbox of things that help you manage your IBS more effectively. So abdominal massage is one thing. Then if we also would probably start thinking, if you are somebody who is affected by stress and anxiety, this syndrome of symptoms that you're experiencing is basically your body telling you that it doesn't like the way that you're managing your stress. And I would certainly at that point be suggesting we need to think about some meditation, some yoga, mindfulness, anything that just helps you manage your stress more efficiently. So then we get onto the more in-depth things and start thinking about the gut bacteria. And here I'll often be asking, have you over your lifetime needed to have antibiotics frequently? Have you had any abdominal surgery, any physical trauma around the abdomen? Very useful to know if you've had children. Did you have them by natural birth or a C-section? Have you had gastroenteritis or food poisoning, an invasion of bad bacteria? Or have you had anything like any acute episodes of big stress in your life, a sudden bereavement, car accident, unexpected redundancy, a divorce, these sorts of things? Or are you somebody who has chronic periods of stress and anxiety? A group that I work with an awful lot are barristers, actually, who are, under a lot of pressure all of the time. Any of these things can disrupt the balance of your gut bacteria. So let's just think about that for a second. You have around 1 kilo, 2 pounds of healthy bacteria living in your gut, in that large intestine again. And these are all doing very specific jobs. They're very crucially involved in digestion, in breaking down foods ready to turn into nutrients, and then helping those nutrients to be absorbed into your bloodstream. In some instances, they will actually make nutrients. So things like vitamin K that we use for blood clotting is produced by the gut bacteria. Your immunity is affected enormously by the integrity of the balance of your gut bacteria. So you've got millions of different species all doing their jobs, and they work in harmony. But often things that are common features of modern life can disrupt that balance. And those are exactly the things like, the antibiotics, the gastroenteritis, the physical trauma, emotional stress. All of these things can upset the balance. Somebody's asked, could you use a probiotic? Absolutely, but you need to be very specific about the type of probiotic that you're going to use, and I'll tell you about that in a sec. So what happens when the gut bacteria becomes imbalanced is that essentially bits of your digestive system can work normally, others start to struggle, and the problem that you have is that gut bacteria doesn't restore that balance itself. All a bacteria does is the job it's tasked to do, and then it replicates itself and dies. So if you've got certain species really proliferating and others that are very depressed in their numbers, that imbalance is maintained. So then if you've had, let's say, some antibiotics when you were kids for ear, nose and throat infections, maybe you had glandular fever, something like that. Then you go on to uni, lots of stress at uni, your bacteria takes another kicking. Then you have a baby, C-section, another kicking. Then you go away and you get food poisoning, another kicking, and gradually your IBS gets worse and worse over time because it never ever repairs itself. That's where a probiotic comes in. Now, again, someone has asked about kefir. Kefir can work really well at maintaining gut bacterial balance, but it's unlikely to be powerful enough to actually restore the balance to an imbalance in your bacteria. The sorts of the issue that we've got around probiotics is they are a food supplement. So very often food supplements, I'm afraid, are really poorly regulated. In fact, dog food has tighter regulations than a food supplement does. So essentially, manufacturers can make all kinds of claims about what these probiotics do when they really don't need to have any evidence of efficacy of how efficient they are. So there's a whole load of rubbish out there on the shelves, and you can easily waste your money. There are one or two that have got some good evidence to back them, and in a clinical setting, these are the ones that I would recommend. So one is called Simprove. It's a water-based probiotic. You can get hold of it directly from the suppliers. It's simprove.com. The other one is called VSL number 3. and that's #3. And again, you can order both of these from Amazon, and those two would be very useful at restoring that good bacteria and the balance of your bacteria. And you would need to take those for about 3 months. The important thing to remember is when you take a probiotic like this, that you take them first thing in the morning, and that you take them for about 3 months. You take them before you have anything else to eat or drink. So first thing in the morning, and then you will give it about 15 minutes before you eat or drink anything. Camilla has asked me about if I can repeat the names of them. Symprove, SYMPROVE, and also VSL #3. This will also, I'll save this and post this up on my Facebook page, where I keep all of my Instagram live, so you can catch up on it later on. So there's one thing where we start nurturing the gut, and you would do this again, as I say, for about 3 months. Nothing in nutrition works quickly, so 3 months to see the full potential benefit. Then again, we now need to think, well, are there some foods that are particularly troublesome to you? And this is where we look at something like Fodmaps. Now, you might have heard of those. Fodmaps are quite a new area of nutrition, and all Fodmaps means it's an abbreviation for the chemical names of some sorts of carbohydrates. So things like fructans, oligosaccharides, disaccharides, FODMAPs, FOD. So you begin to see, you don't want to keep saying fructans, oligosaccharides. FODMAPs is a lot easier. The thing that's in common with FODMAPs is that they are all fermentable carbohydrates, perfectly healthy foods. Many FODMAPs are fruits and vegetables, things that we really consider to be healthy foods, and they are. The only issue that you've got with them is that a large group of people with irritable bowel syndrome struggle with that fermentation. Because of that, you can find that the FODMAPs sit in the large intestine. They're not being fermented in the way that they ought to. And again, you get a build-up of gas. You can often get water flooding into the large intestine, so the stools become loose, and you can then get diarrhea and urgency. And again, this can have quite a significant effect on your bowel movements. Right, so the Fodmap approach. This is something that is really becoming very widely talked about because it's so effective. It is an investigation. The low Fodmap diet is not a diet that you would be encouraged to follow long term. I would implore you, please do not try to follow a low Fodmap diet without some support. There are masses of us who are trained in the low Fodmap approach, but it is not something to take on your own. You'll see it a lot on the internet and on Instagram posts and what have you as being the answer to people's IBS, and it can be really effective, but you've got to know what you're doing with it. So there are 3 stages to a low Fodmap diet. The first thing you look to do is the exclusion phase, and this is where you will take out all of the fermentable carbohydrates, the Fodmaps, for a period of 4 to 6 weeks. All we're looking to see is, do you feel better? If you do, great. That means we know then you are sensitive to some of the Fodmaps that you've removed from your diet. Phase 2 is where we need to see, well, which foods is it? Because you are never intended to follow that exclusion phase long term. I have lost count of how many people come to see me and they're stuck at this first phase. The low FODMAP diet is not a complete diet. It's not a healthy eating plan. It's not something you do long term. Again, it's an investigation. So you must complete all 3 phases of it to really be using it properly. So let's say you've excluded all of the FODMAPs, and there are literally hundreds of foods. This is hard work. You need help and you need support to do it. So you exclude those for 4 to 6 weeks, and let's say after 4 weeks you come back to me and you say, I feel brilliant, I'm really feeling good. There's no benefit or no point to go following the low FODMAP diet any longer at that point, to phase 1 of the diet. We stop then the exclusion and we move on to reintroduction, because now we know FODMAPs are affecting you. Now we've got to pin down which one is it. So in phase 2 of the diet, we start reintroducing the FODMAPs one at a time in a very planned, strategic way. Each one that we reintroduce, you're going to do that for 3 days, monitoring your symptoms, and you will very quickly begin to pick up if there are, usually it's about 2 to 4 specific foods that are, no question about it, your trigger foods. And that's great. So we then start to know, well, those are foods that if you eat them, you're going to feel lousy. Doesn't mean it's going to kill you, but if you go to your mother-in-law's house and she's made something lovely for you, put a lot of effort into it, and it's containing a FODMAP that triggers symptoms for you, but you think, I'm just going to go ahead and eat it, at least that's why you don't feel good the next day. So it's giving you the knowledge, giving you the control. You'll probably find, though, there are some foods that come back through this reintroduction phase that appear to be okay, but that don't really suit you that well. And that's what we sort of call, or I think of as almost like the amber foods. So these are foods that you could probably get away with eating in a small amount once every few days. But if you started to increase that and have them more frequently or in larger quantities each day, you would start to develop symptoms. Similarly, if you mix 3 or 4 of those amber foods together, so let's say an amber food for you was onion, garlic and wheat, and you mix those 3 together in a pasta dish or in a pizza, you might well not feel great after that. And that's what we need to discover, because once we know that, again, once we know what your red foods are and then your amber foods, we can start to personalize your FODMAP diet and produce something that gives you, again, ultimate control to be able to go out for a meal and eat freely without worrying about symptoms. So again, if those were, say, some amber foods for you, wheat, onion and garlic, but you knew that as long as you didn't eat those throughout the day, you could go out for your Italian at night and get away with it and not feel uncomfortable. That makes life a lot easier. So we've begun to look at mechanics with that massage. We've looked at the environment with some clinical probiotics. We're looking at the diet from the FODMAP point of view. And then we need to think about life in general. All of us are living busy, crazy lives. And I mean, stress has been high on the agenda for an awful lot of people in the last few months. Stress has a massive impact on your digestion. And that can be personal stress, it can be emotional stress, it can be work-related stress, but whatever it is, if it is starting to affect your digestion, we need to find a way of managing that. Now, that might be through physical activity and exercise. It might be through some therapy to help deal with stress more efficiently, or it might just be through taking something up like yoga, meditation, Pilates, all sorts of things that can just give you some downtime. Ultimately, IBS tends to be a symptom of modern life. It's not something that's going to kill you, but it is incredibly uncomfortable, incredibly difficult to deal with, and something that affects an awful lot of us. If we just carry on as normal, the only thing that happens is your IBS will get progressively worse over time. Instead of doing that, I would suggest that we start off with a symptom diary. We look at a food and activity diary and we start taking control of it. It doesn't mean that you have to give up eating anything that you've ever enjoyed in your life. It doesn't mean that you have to live like a saint. It doesn't mean you have to change your job, leave your partner, dump your kids, whatever it is that's bringing the stress into your life. What it does mean is that by building together a toolkit of different strategies that you can use to manage your IBS, you become in charge of it instead of it becoming in charge of you. You'd be amazed how many people I've seen who really have to think about what opportunities they accept, what jobs they think about taking, because their IBS becomes such a driving force in their life that it's affecting the choices that they feel they're able to make. I think we can help about 3/4 of IBS sufferers. And some of you may have seen me last week talking about another issue, histamine intolerance. I'm almost certain now that the vast majority of IBS sufferers that I can't help are potentially people who are histamine intolerant, and that is a next phase. So if we do all the things I've suggested and you don't feel any better, we still have one more avenue that we can explore. And that's, I'm sure, something that we'll do as another Instagram live for Fit&Well. But for today, and for the purposes of what we're talking about, if you are worried, first of all, or if you're not even sure if you have IBS, the first thing I would do is keep that IBS symptom diary for 3 random days over a month and see what you discover. If at that point you then decide you want to investigate this further, then there is a wealth of help out there. And I'll very happily point you in the direction of where you can achieve some help. Usually, if somebody wants to work with me to sort out their IBS, it's something that takes around 3 sessions. We do an initial appointment for about an hour. We'll often split that in 2, so we agree what your plan of action is going to be. I'll send you out a load of materials, particularly around things like the Fodmap diet. Make sure you're happy with those, and then stay with you, connected with you through WhatsApp or any other kind of messaging platform, so that I can be with you all the way through this, and you can have somebody that you can lean on, check things with, see when, if you're not sure about something, and have some support all the way through. We can then do the reintroduction phase of the FODMAPs and then get you really with a long-term plan. Because ultimately, any sort of syndrome like this is not something you cure, it's something you manage. And the management comes down to you guys with a toolkit of different things. So it might be that you do your massage most evenings, you take up some new forms of exercise to manage your stress, you try the low FODMAP approach to just make sure that there are 1 or 2 foods that you discover that you can steer clear of, and also look after your gut bacteria. So I hope that's been helpful. I think it's probably half an hour of me talking away on my own is probably enough for you. Some of you have already sent some questions in, which was great. Thank you very much for those. If you do want to find out any more, just drop me a direct message. I will be absolutely delighted to hear from you and see if I can help. We'll save this and get this up on the Fit&Well site and also on my pages, so you'll be able to see it again or let anybody else that you think might be interested in it again. And of course, if you would like us to cover any more issues or subjects around nutrition, just send us a message and we will happily put those together for you for more of these lunchtime Ask the Expert slot. But for today, thank you so much for joining me. It's been a real pleasure to see so many of you on, and take care of your gut. Thank you very much, everyone. See you.